Hi, good morning. Today we'll see about the reason behind renal splay. First of all, we'll understand what is renal splay. So here is a graph which is taken from Guyton actually. So here the x-axis represents the plasma glucose concentration in milligram per deciliter, and in y-axis glucose filtered load, the reabsorbed or the excreted amount in milligram per minute is represented. Okay, now see this straight line which is drawn in the pencil, which is called as filtered load. Means how much amount of plasma glucose concentration increases, it gets filtered through GFR, and it is as the blood glucose increases, means as the plasma glucose concentration increases, the glucose which is filtered via the glomerular filtration also increases linearly. That is what is understood from this straight line. But if you take the amount that is reabsorbed, what happens is reabsorption happens till it reaches the transport maximum. So transport maximum for glucose is 375 milligram per minute in case of males, and it is around 300 milligram per minute in case of females. So what happens till it reaches transport maximum, all the filtered load is also reabsorbed. So after reaching transport maximum, how much ever is filtered is not reabsorbed, so the reabsorption rate remains at the same level of 375 milligram per minute. So after which what happens, since it is not reabsorbed, since it has become a flat line, glucose has started getting excreted through the urine. But we have to see here another specific part of this graph is that the amount of glucose which is excreted does not increase after the transport maximum has reached, but it happens even before that. Even when the plasma glucose concentration reaches 200 milligram per deciliter, and when the same has entered inside the glomerulus through filtration, after when it is more than 300 milligram per deciliter, the glucose start appearing in the urine. Means this happens even before reaching the transport maximum. So this difference in the threshold level and the transport maximum level for glucose is called as a renal splay. So what happens? Transport maximum we have seen. What is the threshold for glucose transportation? Threshold is 200 milligram per deciliter, or it can also be 180. So when it reaches the level above this threshold, glucose getting excreted. It first starts appearing in the urine, and as the concentration goes on increases, it starts getting excreted. So there is difference between the threshold and the transport maximum, and this is called as splay. So why this splay happens? What is the reason behind splay? There are two important reasons that has been proposed for the renal splay. That is, transport maximum for glucose is not the same for all the nephrons. For all the nephrons, it is not the same. That is why it start getting excreted even before reaching the transport maximum. And one more reason is that the reabsorption of glucose is not complete in the nephrons, even when the glucose concentration is less than transport maximum. So reabsorption of glucose is not complete in the nephrons even when the glucose level is less than the transport maximum for glucose. Even when this level is less, The nephrons are not completely reabsorbing. That is why there is the difference between the threshold and transport maximum, and all the nephrons do not have the same transport maximum. So this is the reason for renal splay. Hope you understood. So this is the graph. Thank you. We'll see with another reasoning out question shortly. So now we'll see what is the clinical importance of this renal splay. So normally the fasting blood glucose level is 70 to 100 milligram per deciliter. That is the blood glucose level at fasting stage and overnight fasting, and after food intake usually the blood glucose level remains less than 140 milligram per deciliter. And if we take the random blood glucose level which is taken any time of the day, irrespective of fasting or postprandial, it should be less than 200 milligram per deciliter. This level is in case of a normal subject. The person who is having normal blood glucose level should be of this kind. Suppose if the subject is diabetic, what happens? The blood glucose level will increase. We all know, because of absence of insulin, the blood glucose level will increase. So if the random blood glucose level can go more than 200 milligram per deciliter, or even the postprandial level also can go more than 200. In some patients even fasting will be very high. So in those conditions, in case of diabetes mellitus, what happens? The blood sugar level will increase more than 200 milligram per deciliter. Now what happens? This is above the renal threshold. So this level is more than the renal threshold for glucose. So when this level is more than the renal threshold for glucose, what happens? These diabetic patients, they will start excreting glucose through urine. So when the glucose is present inside the nephrons, what happens? It will also increase the osmolarity inside the renal tubules. So when the osmolarity is increased, since it is getting excreted, glucose will remain in the renal tubules. It is not reabsorbed, isn't it? So this osmolarity will increase. So since this osmolarity is more inside the renal tubules due to the presence of glucose, more and more osmotic water reabsorption happens. Osmotic water reabsorption happens. So this will result in more and more diuresis. What is diuresis? So more loss of water, and this water loss happens due to osmotic water reabsorption, because glucose started excreting after the threshold value for glucose. Now the glucose will cause osmotic water reabsorption. More and more fluid excretion will happens. So osmotic diuresis will happen, and because of this there will be dehydration. So because of this there will be dehydration in case of diabetic patients. So hope you understood the clinical importance of this renal threshold for glucose. Thank you.